And I think you've spoken about this before, about the difference in the developing world and the developed world. What I'm interested in sometimes are blind spots or literacy challenges in the developed world. That in the developing world, you know, what I'm fascinated by, if I go to an African country, I've seen people much more aware of how to use their smartphone to, you know, look at their cardiovascular situation, which I know is another dimension of what Tom's group works on, or, you know, knowing other dimensions of sort of health benchmarks. And they're tied into their smartphone. They've got smart stuff. Qualcomm has funded, you know, a ton of these kinds of initiatives out there. But when I go to Bartlesville, Oklahoma, or I go to Baton Rouge, Louisiana, or I go to Dubuque, Iowa, I see highly illiterate folks about their own health, and I don't see healthcare systems that at least from my side on the retail side, that seem to be up to the standard that you're talking about. So I'm sort of interested in whether there's a little bit of hubris packed into what we think we're doing in the United States if we had something serious break out here. So talk me down, and am I wrong that there's some strengths in the developing world that we don't talk about enough?
Yeah, I think there's two areas that I would point out. You know, one is delivery of interventions. You know, many developing countries are very familiar with planning, executing, and succeeding in mass vaccination campaigns, whether it's for measles and rubella or for polio, mass antibiotic campaigns for trachoma. The U.S. hadn't been doing that for a really long time. So even in 2009, when we did, you know, got 80 million people vaccinated against H1N1 influenza, that was a stretch for us. We didn't have that it was a stretch for our systems, and it was a stretch for the public. And I think in communities around the world where mass campaigns have been happening because there wasn't as strong primary health, that's still there. The other thing I think is around community engagement and trust. I met with folks from California in the health department responding to the wildfires. And I mean, everybody heard those tragic stories of, you know, people, you know, somebody knocked on a door to try to warn a neighbor to evacuate, and the fear of who was at the door. You know, I'm not going to open the door. I don't trust my neighbors. I don't know my neighbors. We're not a community anymore. And so I think that there's a lot to build on in developing countries and a lot we can learn from. And I do think we have to be very humble in the United States. We spend a lot of money on things, but we still have a lot of improvement.
Yeah, and I absolutely agree with what Ann said, and I'd only add to that this growing anti-science skepticism we have about vaccines in our own country. And so one of the most ironic conversations I'd have during the Ebola outbreak would be people would say, I don't understand why people in West Africa engage in these burial practices. They're spreading the disease. Can't you just explain the science to them? Can't you just tell them this is bad? And someone would have this conversation with me, and in the morning newspaper, there'd be a story about a measles outbreak in Orange County, California, because people in America didn't believe in science and didn't think their children should be vaccinated. Right. So, you know, we have to constantly be vigilant here about making sure that in our own country, we're aware of the importance of vaccination, we're aware of the importance of these scientific developments, the issue of trust, which someone mentioned at the kickoff of Spotlight Health yesterday. Ann reinforced here is an important issue, but we can't let our guard down. Complacency, as Seth mentioned, is a huge problem. We're seeing this a little bit in our own healthcare system now around pandemic response. After the Ebola outbreak, we set up these 10 regional hospitals that are ready to, supposedly ready to treat an outbreak of a dangerous infectious disease. And last year, the time it would take one of those hospitals to accept a patient actually went up. We got less prepared last year as we get a little further away from the crisis and everyone lets their guard down just a little bit.
You know, we have cancer vaccines. I mean, you know, and cervical cancer vaccine, Rwanda has a 92% coverage rate. I remember you tweeted and said, if only we had a coverage rate like Rwanda, we would save X numbers of women in the United States. I mean, it's really crazy. So, you know, not only complacency, but it's this issue of who do you trust. And on the internet, you know, they have these fancy names of anti-vaccine sites that kind of sound like CDC and National Vaccine Site, you know, and the problem is that it's hard to tell truth from non-truth in that circumstance.